pretty much daily in my daily practice, I'm faced with, a myriad of allergic conditions. The common ones you'll be familiar with: eczema, allergic hay fever, rhinitis, asthma. Those are the common conditions. And when you go into firstly, people are like scared of medication, right? There's bad press about that. And then when you ask people what they take, normally allergy patients bring out like a bag of, thousands of rands worth of supplements, herbal consumption, vitamins. And almost daily I get asked about, which of these ones really work, or do they work, or what do I recommend, all those things. So although my, the sort of training as a physician in this country, the burden of disease is still heavily HIV, TB orientated, allergic diseases are on the rise.
Yeah.
So that's something to say. There was a allergic rhinitis study that was done, which included a South African population, and we have a prevalence of about 20% of people with quite severe allergic rhinitis. And I think we chatted most recently about pollen, didn't we?
Yeah.
And last season, the pollen season, my phone was ringing off the hook after these interviews that we did, because we had record high pollen levels. And that sent everybody, asthmatics, to the hospital and allergic rhinitis. And unfortunately, if you look at asthma, which is, allergic rhinitis makes people's lives uncomfortable, but doesn't kill people, but asthma does. And unfortunately, although we rank 14th in the world for asthma prevalence, we rank 5th for asthma deaths. So we have a growing problem, and this is across ethnicities as well. It's not confined to a particular ethnic group. And we see even food allergy and those conditions are on the rise. So the burden of disease from our perspective is increasing, and that's actually shifted. Not only is my sort of basic interest in immunology and the kind of mechanistic has shifted my work from kind of TB and to more kind of interesting topics, one of which is endemic substances or other essentially supplements that may have an impact on allergic diseases. And that's kind of how I got into this. So the clinical practicalities of people asking me about this. And also actually when we had our first child, we went to the baby clinic and she had some seborrheic dermatitis. And then the lady was telling me, pop 10 rooibos tea bags on the head. I was deeply skeptical of this whole business. So those things, and as you say, like I actually, like to drink rooibos, and so my family drinks rooibos. So I thought to myself, this would be an interesting topic. So I actually started then reading about this around allergic disease and rooibos. And what's interesting is that there's definitely a mismatch between, I do think that rooibos is great, but there's a mismatch between public perception of what rooibos can do in allergy and what actually is published in the scientific literature and forms an evidence base. I mean, if you're a drug like inhaled steroid for your nose, you have to go through 10 or 15 years, multiple trials to actually demonstrate efficacy. And that data just simply isn't there for rooibos tea and anti-allergic disease.
Is it because we haven't been focusing on research?
So essentially, the scientific data is just not there. And that's actually what then made me think, well, look, we should now try and produce some kind of scientific evidence around this topic to see whether or not this is actually true. And so again, it starts, with the literature review. And interestingly, there is quite a lot of there's some animal and some cell data, right, that relates to the use of, or the application of rooibos in allergic disease, but more broadly in immune inflammation. So, we put that slide up, inflammation. I know there are others that have worked on inflammation. And being an immunologist, I hate the term inflammation because it's the most broad term you can ever imagine. And allergic inflammation is very distinct. It's got a distinct profile. It's got a distinct set of immune cells that are involved. And so really, like, if you kind of delve into the detail, there just isn't that much data, and there's certainly almost no human data. There was one study done in 1989 by a Stellenbosch investigator where, they used skin prick testing in a few patients, and they didn't really find much effect of that study, but there was a lot of methodological problems, and I felt that we needed to go back to the basics first. So that's kind of the background.
So what are you doing now?
So what we've decided to do is I have, as part of the routine my routine diagnostic lab, we run diagnostic allergy tests. And one of the ways that we look at whether or not you're allergic to, say, house dust mite or to grass or to a particular food is we take your cells from you, we then isolate your basophils, which are a cell involved in the allergic inflammatory response, and then we see whether when we add the allergen, let's say house dust mite, we can get your cells to activate. And we've got a readout and we compare that to normal populations, and that gives us an idea your cells are reactive to house dust mite. So that's a routine assay that we run in our lab. And so we actually thought that we would start very simplistically and we would look at whether or not if we added different concentrations of rooibos tea to these cells with the allergen, let's say house dust mite, in different people that we know are allergic, could we modulate or could we change what happens to the upregulation or the activation of these cells? That's how we started. And very, very encouragingly, we found a very strong effect. And what we've seen, which is very interesting, is that the effect does not seem to be specific to a particular allergen. So it doesn't matter if I stimulate you with house dust mite and if you're a house dust mite allergic, because a lot of patients that are allergic to more than one thing. You might be allergic to house dust mite, to grass, to peanuts, a whole lot of things. And what we see is actually a kind of non-specific suppression with different concentrations of rooibos, and we've got a very nice dose response too, which is another sort of scientific method about saying that the results are in fact true, and that's actually what you're seeing that's related to the substance. So that's where we started. We then have got some preliminary, we've got a collaboration with a German scientist where we're looking now at mast cells, and mast cells are the kind of most well-known allergic cell, and they're the cell that make people's face swell up when they or give you big hives, or perhaps make you have bronchospasm and asthma, right? They're well known. They produce these chemicals or they release them. And the process of release of these chemicals is really key to allergic inflammation. And we've done the same to those cells and seen a very similar effect.
All right. So the data that you're collecting, and I understand that it's all preliminary, what are you seeing?
So we see basically that rooibos can have a broad non-allergen specific suppression of allergic inflammation, and we see this both on basophils and on mast cells, the two key allergic cells at the moment. What we don't know, obviously, is how that in vitro cell work translates back into all the questions you were talking about.
Because the next question then is, as I asked Janine earlier, does it matter how I consume that rooibos product?
Correct. So that's basically the next set of research. So I wanted to see that for myself, that human cellular data. So now I feel like we are quite confident that there is a cellular effect. Now it becomes much more back to the clinic. And so that's our next step, is we're in the process of getting approval, and we've got support now for a small clinical trial in allergic rhinitis. We've got this very kind of nifty way where we take allergic patients and we literally put house dust mite in their nose and measure how their inflammatory response is. And now we're going to test whether or not we can use rooibos tea to change that and decrease that clinically. Right? And that's where we're going to be able to explore questions like what dose, is it 2 cups, is it 6 cups, do you have to drink 25 cups of rooibos tea to have any kind of effect? Do you need to have any build-up? So should you drink rooibos tea for 5 days in a row and then your effect will be better, or is it okay, like you were saying, to just drink 2 cups in the morning and then that you will immediately be better? And then, of course, direct application will be another thing that we'll be exploring. So we have a very interesting group of patients that have something called oral allergy syndrome. It's a type of allergy that relates to pollen. So the patients are primarily reactive to pollen, but there are certain molecules in pollens that cross-react with certain fruits and certain vegetables. And these proteins that they react to are heat labile. In other words, they are very sensitive. They get broken down if you heat the food or if you digest it in your stomach. And these patients, when they have, let's say they have a banana or a peach is the classic one. If I take a peach, the peach will make their mouth itch and be very tingly. But once they swallow the peach, the symptoms will go away. So it doesn't give you a systemic allergy.
Yeah.
And so one of the things we want to look at is whether direct application of rooibos will impact that. So we will apply rooibos directly to the mouth. You can rinse the mouth with rooibos and then see whether or not we can decrease the effect of these fruits.
So what kind of rooibos are you applying? Get brew a cup of tea and
Correct.
then ask them to, okay.
Yeah, correct. So interestingly, and that's another interesting point in why it's important to study rooibos in different diseases, is because our preliminary data suggests that the fermented product, the red rooibos, is actually more effective than the unfermented rooibos. And of course, you've heard, I think, that the unfermented rooibos is enriched essentially for antioxidants. Now, there's some preliminary animal data that the relevant molecules to an allergy in the tea might not be the antioxidants, right? So it might not be the aspartame, that might not be important. There are a couple of other molecules like griziolol and luteolin. I'm not saying this maybe correctly, some other people will say it better.
And if the scientist is not saying the names correctly.
So those might be actually important. So that's another aspect that we are, so simultaneously to the clinical side, we are still staying with the basic science and we're trying to look at where in the inflammatory pathway of allergy the rooibos is actually acting and what specific component of the rooibos is relevant, or maybe multiple components. Because I think that actually we've only got one preliminary experiment where we found quercetin. Quercetin is another molecule in rooibos tea that's you can buy commercially. It's available as a single molecule preparation. And we've only done one experiment on this, but we haven't seen the same effect, right? So it might be that it's a collection of molecules, which would be good for rooibos growers. If we can't isolate one molecule and exploit that, like we've done in other drugs. But so it seems that maybe there might be a collection of molecules that are relevant. So simultaneous to the clinical, we've got the kind of basic science stuff going on as well.
An impossible question. Do we know how long it's going to take before you start seeing some definitive, conclusive results that then will see applications?
So the way that we, just from a funding point of view, because these are expensive challenges to do and the logistics are quite difficult, we've got a preliminary pilot study that we'll do and hope to complete by the end of the year. And that will give us like a go, no-go decision. So if we're seeing an effect that's small that we think worthwhile, we'll then conduct next year a more powered study. So probably a definitive answer in terms of allergic rhinitis will be the end of next year. If depending on, if we don't see anything early on, we might change tacks. We might look at other, because each disease might be different. Eczema might be another avenue with direct application. So it depends a little bit on what we find, but probably I would hope to have some kind of more definitive clinical answer by the end of next year.
A left field question, is anyone allergic to rooibos?
Not that I've seen. No, not that I've seen.
I've never come across,
So what's interesting is that, so the other question, just like anecdotally that I get asked a lot, is people from the Cape always come in and sit in my office and say, Doctor, I'm allergic to fynbos, right? Now, very few people are in fact allergic to fynbos because fynbos is pollinated by insects.
Yeah.
And the aeroallergens or the grasses are wind pollinated, and those are the things that you become allergic to. So the only sort of people that become allergic to fynbos are often like fynbos handlers, people that directly handle it. So it's not very, allergenic in its origins. Yeah.
That's very interesting. Thank you very much.
No problem. Thank you.